Hi, I'm Dr. Artis, and today I want to talk to you about the top 10 reasons for low back pain that I see with my patients. Number one, we have a herniated disc. A herniated disc is when the disc actually sticks out and hits the nerve. That can be very painful and it takes a while to actually happen. That's where you actually get a tear in that disc and it slips out and it really hits that nerve. Very, very painful. Then the second one we have SI dysfunction, SI joint dysfunction. So you have the sacrum and the ilium. Those two bones come together and they form what we call an SI joint. That joint can actually shift and cause irritation there from the ligaments and also some of the muscles in around the area, and that can cause a severe amount of pain. Then we have third, the osteoarthritis, which usually happens around the disc and around the bones, the edge of the bones where they start to wear down, and that can be from just normal wear and tear. However, when your spine is all out of alignment and shifted different places like that, it speeds that process up because you put more wear and tear on those joints. Then we have deformities. Deformities could be simple things like scoliosis, where the spine is shifted to one side like that, and then you actually have people coming around. A lot of times people don't even know they have scoliosis because they haven't been properly diagnosed and they can't explain why they have that pain. And that's one of the reasons why we take x-rays. Then you actually have kyphosis, where the spine shifts over. People start to call that more so of a humpback. That could be very painful. Those two are some of the most common deformities that we see. Then you also have spondylolisthesis. Spondylolisthesis is a little complicated to explain, but what happens in that process, you have two vertebrae that actually are sitting on top of each other and one slips forward anterior. When it slips forward anterior, it chokes the cord that goes down in the spinal cord, and that can be very painful. Also, we have facet syndrome. Facets are these things right here where these bones actually attach to the next bone. So you have the bone on top and the bone on the bottom, and they attach with the facets. And when they attach with those facets, sometimes those facets could actually shift out of place and they can become irritated, and that can cause a lot of pain. Then we have degenerative disc disease. That's where the discs in between the vertebrae start to degenerate. When they start to degenerate, that could be very painful. That's usually from wear and tear. Sometimes it could just happen over the course of time for just nature. Your body being out of alignment and not giving the right amount of hydration and so forth. And then we have spinal canal stenosis. Spinal canal stenosis is you got the spinal cord that travels down through here. Now imagine you got that spinal cord that travels all the way down, and actually you take arthritis and all these conditions and it actually tightens up around that cord. When it tightens up around that cord, anytime you move, that could actually cause a lot of dangerous pressure. It could be very painful for people to move. Usually happens with age, but it can also happen from other things too, like trauma. Trauma is the ninth reason and one of the main reasons why we see a lot of patients that come in with low back pain, because that can happen from slips and falls. That can happen from shoveling the snow. That can happen from repetitive motions, different things like that. It also can happen from car accidents. And that's usually typically going to end up leading to other conditions like strains and sprains and maybe even some herniated discs. The other thing you have too is you have the last one is you have compression fracture. Compression fracture is very, very important to understand. That's where the muscles around this area are not strong enough to support the vertebrae and the ligaments become weak. And so the spine starts to collapse and it actually compresses the vertebrae. When it compresses the vertebrae, that can be very, very painful. And you have to sometimes, depending on what it is, you have to get treatment from those things. Now, reason why I go over the top 10 reasons on why people have low back pain is for the simple fact that number one, we have to understand exactly what it is so we can treat it the best way that we can. And how we do that is we sit down and we do a history, then we do a physical, and that could be a examination where we actually moving you with orthopedic tests and so forth. That might encompass x-rays or possibly an MRI or a CAT scan. And then we actually look at all those things, perform the proper diagnosis that we can diagnose you with. Therefore, you can get the best treatment. I see a lot of patients come in and they say, "Doc, I'm in pain. I just want to get out of pain." Hold up, slow down a little bit, trust the process. Let us understand exactly what's going on, what the proper diagnosis is so we can get you the best treatment. So I hope that helps. If you like and subscribe to my channel, thank you. I'd rather comment below if you got any questions. And if you want a consultation, don't hesitate to call my office at 708-614-1414. Thank you. Bye.